Welcome back. India's active coronavirus cases have climbed to 5,700, with Kerala leading the surge with 1,806 cases. A surge in cases is also being reported in Delhi, Bengal, Maharashtra. Official data shows a total of 59 deaths in the past few weeks, and in the last 24 hours, 4 people have died. Most of the cases, although, are mild, and there is no need to panic. But surge is also happening across the world, with countries like Thailand reporting 20,000 cases in a day. So what should you do if you suspect COVID? Is a booster shot of vaccine recommended? Let's address all these questions with our expert. But first up, we are joined by Dr. Naresh Trehan, who is the chairman of Medanta. Dr. Trehan, appreciate you taking out the time and speaking with us. Well, sir, although there is no panic now, cases are rising every day. Should we in any manner be worried about a peak?
So certainly we are worried as healthcare providers, we are very worried, but the point is not to panic right now, that is correct. So what we are saying today is that, look, you have to be cautious, exercise all the techniques that we talked about at the time of the COVID wave, about separation by 6 feet, taking precautions of not spending too much time talking closely to any individual. Third is to anybody who has a cold or a cough, we are advising today to isolate themselves for at least 5 days so that the people who are close to them do not get infected. But if that cough and cold is accompanied by fever, then they should get their COVID test done also. And that 5-day isolation that we talk about, at least the last 2 days of those should be without fever. So these are the minimum precautions we are advising people to take right now. We know that it is so far we know that it is a sub-variant of Omicron, and some variants have been identified like JS1 and J1 and all that. The basic thing is that we should be aware of the fact that COVID is spreading. We also know that most of the cases are mild. And we also know that the variants which they occur from one, that they because it's a variant of Omicron, that usually they are milder. Now, what is left today to understand is that what the gene sequencing that is being done by the government laboratories will tell us that is this gene, in case it increases and becomes rampant like an epidemic, is the current vaccines that we were using before, are they effective against this or not? So we have time, and so this is being tested right now. So we are saying right now that we don't know what the effectiveness of this vaccine is, so we are not recommending that people take the vaccine today. We should wait till we have a determinant of how rampant this will get and how most people will recover, and whether by the testing, whether this variant is actually controllable by vaccination. So these are question marks which are open right now. But coming back to the fact that you have to be taking care of your nutrition, that you are healthy, you need to exercise to build your immunity, and also cautious about the recommendations for in times of COVID, that we should be exercising them today.
Hey, Dr. Trehan, what are the first indications of catching the current COVID strain according to you?
It's basically, most common thing is a sore throat, a raspy throat, along with fever, then follows, and some people will get it, some people will not, but most people will get fever after raspy throat and a cold. So anybody who has trouble swallowing or has a sore throat should be cautious, get yourself tested, so that and it's simple enough to get yourself tested, and you will know whether you have COVID or not. If you do have, of course, you'll isolate yourself immediately, but people who have persistent cough and cold right now with fever, we are recommending that they self-isolate themselves, but they should get their test done also, so that we know that how rapidly is it spreading or not spreading, and how to protect the family members and the surrounding people who are associated with that person.
And so, what would your advice be to the people who are seeing these symptoms? What should they do?
So I'll repeat that basically it is spreading, no question. Maharashtra has over 550 cases. Noida also is showing some signs of increase in numbers. In Gurugram, that we saw in our own hospital, we had about 23 patients, most of them very mild. Two of them required ICU because of the fact that they have pre-existing lung disease. So today, if you take the warning, one, everybody should be cautious. Second, especially those people who have pre-existing lung disease or heart disease, they are more vulnerable. And people who have diabetes, which is of long standing, also their immunity is low. So all of us must actually make sure that we are getting enough nutritious food. We are exercising at least 4 to 5 times a week, at least 4 kilometers of brisk walk or any other exercise that is equivalent, so that your muscle mass stays okay, your immunity stays intact, and that is because of this fact that this is an Omicron variant that we are hoping that it is going to be very mild, which is so far the indication. Only there have been 54 deaths lately reported in the country. Now, the analysis is being done. Are they more, those people who are more comorbidities they have, whether they are the ones who are victims, or is it like in the general healthy population also it is virulent? So all these things will clarify themselves in the coming days, but in the meantime, one can protect themselves. Everybody should try to protect themselves and stay away from people who have a cold or a cough or a fever, and also avoid crowded places.
And so, would you recommend a booster shot of the vaccine again?
No, as I said earlier, we are not recommending it right now because we don't know whether there is the previous vaccine is effective against this one. We don't know what is going to happen in the future. It is a possibility that, like we recommend flu shots for elderly people or comorbidity people every year, that this may be also part of the vaccination system in the future. But this is not clear right now. The outcome is still to come because the genetic analysis, the gene sequencing is being done to all the variants that we are finding, and we'll know whether they are actually susceptible to the vaccine that we were using before. So just wait. This is not recommended right now by us.
And is India better prepared, you think, for hospitalizations since the Omicron variant spreads quicker than the other strains?
Yes, it is true that because we have had experience with it once, and I hope we don't have to repeat it, but if it is required, we can very rapidly, most hospitals can very rapidly repurpose themselves to deal with COVID patients. So, like I said, I hope it doesn't reach that stage, but if it's needed, then we can all actually respond very quickly like we did the last time.
Dr. Trayan, appreciate you joining us, sir. Thank you so much. All right, so we'll continue talking about this with Padma Shri Dr. Sanjeev Bagai, Chairman of Nephron Clinic, Dr. Naresh Chawla, Vice President of the Delhi Medical Council, also with us on the program. Dr. Bagai, thank you so much. Dr. Chawla, appreciate you being here. Dr. Bagai, I'll begin with you. Well, Dr. Bagai, you've been down that road with us, especially me, when a number of COVID variants started wreaking havoc in and around the world, in India as well, at the beginning of 2020. What we have today is reminiscent, a reminder of what happened a few years ago. But the big question on every Indian's mind, Dr. Bagai, this is something that I also asked you over a WhatsApp message just a few minutes ago, is there something to worry about? And if not, then why do you think so?
Good evening everyone. So this is a breakaway of the Omicron major variant, and Omicron itself has broken away into BA.1, BA.2, BA.3. This particular sublineages which we are seeing in the Indian subcontinent and indeed Southeast Asia, China and Japan is a breakaway of what we call as BA.2.86. This major parent variant has then given rise to JN.1, which we are seeing in India. It has given rise to LF.7, we are seeing in India, and LP8.1.1, which we are seeing in India. In different parts of the world, we are seeing different substrains. Overall, as a capture view, these sublineages, subvariants have got a unique set of mutations, what we call as flip mutations. They are mirror images of the previous ancestral strain. They have lost the infectivity, but as a trade-off, it has increased in transmissibility. So very quickly, just let me explain this. It latches onto your body mucosa, it's your upper respiratory tract, but not the lower respiratory tract. Therefore, these sublineages are not going to give rise to that much amount of hypoxia, oxygen dependency, ICU admissions, fatality, and death. But since it is more transmissible, person-to-person contact, it can keep spreading. So like we've said for the last 3 or 4 years, 5 years, more we test, more positivity we'll get. As far as the healthcare system is concerned in Delhi and vis-a-vis India, we are extremely well prepared. We've gone through this for the last 5 years. To ramp up the systems will take less than a day. But at the present moment, the clear message is there is no panic. The vaccine program of India, which we had in 2020 onwards, we have given more than 220 crore plus. That means more than 90-95% of the eligible population have been vaccinated twice, and more than half of the vulnerables have been given a booster. That has held us very good because not only the neutralizing antibodies were there, but we built a T cell arm of immunity, so the population at large has built a good immunity. But these subvariants are extremely immune evasive. So they are called as the fittest variants. That means they slip the body immunity. But since the Indian vaccine program has been so good, we are in a reasonably good space of comfort, but not being complacent. Do we need a booster? The answer is clearly no, for 2 major reasons. At the present moment, it is not that lethal, which requires the vaccines. And the second point is, in the Indian subcontinent, we've used 2 vaccines. One is the Covishield and the other is the Covaxin. They are both adenovector-based platforms. At the present moment, internationally, we have sublineage-specific vaccines. So we have JN.1 and KP.2 vaccines. So the old vaccines will not work very well for the present sublineages. Therefore, no vaccine and no booster right now. Simple precautions, masking, especially during travel and summer holidays, keeping social distancing. If you have a cold and cough, isolate yourself for 5 days. If someone has a cold or cough, keep away from them. Avoid crowded places, poorly ventilated places. Do not self-medicate. No need of antibiotics, no need of any antivirals, which we were clamoring for during the Delta wave. And clearly, there should be no anxiety. Keep good nutrition, look after your pre-existing comorbidities if you have, and just keep calm.
Absolutely. Good advice. Dr. Chawla, do you think there is any necessity to panic at this point in time? And do you think that people who got vaccinated a few years ago when COVID was at its zenith, perhaps need to be looking at the vaccine again? Or do you think because of the mild nature of this particular variant, there are precautions necessary, but there is no need for panic?
Frankly speaking, just imagine, just 25 days back, there was no talk of corona at all, COVID-19 at all. Just in last 25 days, when it started in Southeast Asia, particularly Hong Kong, Thailand, and China, then we started seeing cases. First, a bigger number of cases in Kerala, then Maharashtra, then the other states picked up. If you really ask me, people tell me, Doctor, there's an increase of this many 1000%. So I just tell them one thing: all those cases we have been seeing throughout, perhaps they were all COVID-19 only. COVID-19, what we see now, is largely endemic. We keep forgetting one fact, that before the invent of the big pandemic in 2020 and 21, the people used to fall in the same cough and cold, the same headache and feverish condition. We used to always feel it this way. They were cases of influenza. So I feel all this reaction now, overreaction, I would say, over response, I would say, is absolutely unwarranted. This is simple, Karuna. Even in my own OPD, when I see, for example, 50 patients, and I after 50, if I feel around 35 to 40 are a simple flu-like condition. And I asked them, do get tested corona? They said, Doctor, it gets all right so easily. Why get tested? So the increase in number of cases we see because of more testing, and further increase we don't see because the testing is not being done that extensively, because most cases are simple and easily can be treated by simple isolation, no antibiotics, simple paracetamol, 4 5 days of rest, better hydration, good nutritious food, and it is all over. All the hula bula and the noise about it is the 55 deaths out of a patient of hardly 5.5 thousand. Imagine out of a population of 140 crore. So it is already exaggerated. So I would not say that we should not bother or we should not take precautions. Precautions, yes. Panickiness, not at all. And I would again repeat all the to all the viewers of yours, the simple corona protocol of using a mask when you go out. Number one, hand hygiene, either by soap and water wash or sanitization, and do not overcrowd and go to crowded places, and look after your nutrition. As far as the controversy of immunization is concerned, the immunization has already faced a lot of controversies that all the excess heart attacks, all the excess strokes are being caused by the vaccination. My answer is perhaps yes and perhaps no also. So this were two vaccines, Covaxin and Covishield. They were approved for emergency use only. They were not extensively tried. There is no question of taking another shot at all. But I must tell the viewers, because of the large number of people having taken the vaccination, plus large number of people having suffered the subclinical infection, we have got a herd immunity. I personally feel we Indians as a society, as a class, as a nationality are protected and we have nothing much to worry. So as we used to bother less about simple flu,
Right, sir.
don't forget this much of mortality was there when the flu was also there in before 1920.
The-
Same should happen now. So no reactions, simple precautions.
That's
Get
it.
to
That's a
the
good
end of
point
it
to
now.
make. That's a good point to make. Dr. Bagaia, I have a very specific question for you, and please indulge me. Even before this surge in COVID was around. I remember reading about COVID cases being reported in India every now, here and there, from time to time. There were sometimes 10 cases reported in a day, sometimes there were 400 cases reported in a day. How is this different from that?
See, COVID, when it came in 2019, it was a novel virus. It was the first time which came in contact with a human being. We didn't know the genomic code at that time. We had no knowledge of the type of proteins which it contains, the spike protein, the receptor binding proteins, and so on. Over a period of last 5 years, the present variants are extremely milder as compared to the alpha and the delta wave. The second point is the initial vaccines which were used has given a good protection arm to the Indian community. And over a period of time, because of asymptomatic carriers or milder infections, subclinical infections, we've developed an added strength of natural infection induced immunity. Plus, there is a concept of what we call as cross immunity. So we are reasonably well placed as far as a national level immunity is concerned. But since this virus is more transmissible, we have to still be careful. The best way not to get COVID is to prevent COVID. The only reason why I say this is that even if it is mild, you can still have symptoms of long COVID almost 6 months to 12 months later. There are enough international studies which have been published even yesterday in JAMA journal, in which even children from 14 to 15%, depending upon the age group, under the age of 18, are predisposed to long COVID 6 months after the initial attack. So long COVID is not a good thing to get. The best way forward is protect yourself and don't panic, do not worry. No medication apart from paracetamol and distinctly no vaccines at the present moment.
Dr. Bagai, what about children? It's a good thing that children don't have schools at this point in time. It's summer holidays.
Yes, so in any case, in children below the age of 12 in India, we were not giving the vaccines. Internationally, the mRNA vaccines and the Novavax, which is being used, was being given to children beyond the age of 4 to 5. But in India, since the schools are closed, the close transmission in classrooms, in buses, in school buses, playgrounds will distinctly be lower. Although there is an added risk of summer break, holidays, traveling, airports is a great conduit for transmitting infection, and so are the aircraft. So, simple precautions while traveling. It's important that especially the elderlies who have comorbidities, specifically heart disease, hypertension, asthma, chronic lung and liver disease, immunocompromised, beyond the age group of 65 especially, they be more careful because they are more vulnerable. But otherwise, overall, there is a sense of calmness in India, at least as far as the medical community is concerned. And we are entirely sure that this is a very, very mild strain and it should not create the havoc which the earlier strains had done.
Dr. Chawla, what about people with respiration issues, people with asthma, the elderly, and people who have a compromised immune system? What precautions would you advise for them?
You have very rightly asked if there is any section of society we need to be looked after better. This is this only the children who are particularly under 5. Number two, the people who are above 65, and number three, the vulnerable section of the society. And mind it, since the longevity of life in India is longer now, we have a large number of people who are uncontrolled diabetics, who are on immune deficiency diseases, who are on any organ transplantations, COPD, coronary artery pulmonary disease, chronic kidney disease, chronic lung disease, chronic heart disease, all plus the people who are on some drugs which are immunosuppressants. All these patients are still vulnerable. Now, every life is precious. So every life needs to be protected. All those people should, on the right first day of their fever, they should get RT-PCR to be tested. We should not even wait for a single day. These are the people who are living their life on an edge. These are the people who can easily lose their life. They should be given all the treatment, should be hospitalized at the earliest. Because the matter of fact is, even with influenza, the mortality was the same types as it is now. But as the India is growing medically and we have every life to protect, so we should be more careful about and protection. Old people, whenever they go out, use a mask. Old people do not go to crowded places. Old people, normally the senior citizens and our people, I won't say that they are neglected, but they need to be taken greater care by their nearby or other their relatives, rather than because I see because of the breakdown of the society, many old people are less.
All right, sir. All right, sir. So, thank you, sir. Dr. Chawla, Dr. Bagai, we unfortunately have run out of time, but I'm sure we'll talk again. Thank you so much for joining us. We take a short break. Be right back.